now we're going to do what we call posterior anchor breathing, okay? So you have a couple core anchors. You got our front anchors up here by our ribs and our pubic bone, and our back anchor kind of at the bottom of our ribs, okay, where your lumbar meets your thoracic spine. So what we're going to do here, a way to help reset your breathing and your nervous system to help down-regulate your pain, we're going to do this posterior breathing. So a lot of times when it comes to doing exercise, people talk a lot about either hollowing your core, where you're kind of sucking your core in, or doing an ab brace, where you're kind of tightening your belly and trying to hold it snug, okay? This is kind of a third way that combines them a little bit. So what you're going to try to do, instead of doing the bracing and the hollowing, or even that diaphragmatic breathing where you're kind of pushing your belly out, what we're going to do is time our breathing with a muscle contraction, but we're going to try to push the air into our low back area to stretch out our back, calm down our nervous system, and get some of those muscles that have been stiff and tight to relax, okay? So what this looks like, you're going to lay here and you're going to breathe out, okay? You're going to breathe all your air all the way out like this. Go. Okay? Once you feel you have all your air out, you're going to get even more air out, okay? So you're going to push it out 2 more times. Go. As you do that, you're going to feel your muscles sink in, kind of like a corset coming around your whole spine. We're trying to get every muscle in there. I don't really care about specific ones. Some people get carried away with the transverse abdominis or other certain muscles. We just want to engage our whole core, okay? So as you exhale and do those 2 puffs out, we get all those muscles engaged, okay? Then what you're going to do, when you breathe in, instead of doing diaphragmatic, where we're letting that belly come up and you lose all that energy by relaxing your core, you're going to keep your core muscles on and snug, okay? It doesn't have to be the hardest contraction, but maybe 50% tension as you breathe in, okay? So you'll keep that tension, you go, and as you do that, you should feel that pressure come into your low back area right here, almost like you're filling your low back with air, okay? That's what you want to try to picture it as. So putting it all together, here's what it looks like. Exhale. 2 extra puffs. It's good and snug. I keep that nice and tight. As I inhale, try to keep my ribs down and breathe in. I feel that tension right there. I'm going to blow all the way out. My ribs are down, my pubic bone's coming together. This is staying flat. I breathe in while keeping about 50% tension here. Ribs are staying down, I'm not flaring up. Some people, as you breathe in, you might kind of lose that control right through here, okay? So again, breathe out, ribs down, all the way out. Ribs and pubic bone stay together, back is flat. Keep that tension and ribs down, breathe in. Breathe out. Keep the ribs down towards your pubic bone. Breathe in. Really feel it, stretch that back. Breathe out. 2 puffs. Keep that tension, breathe in. Empty all the way out, 2 puffs. As you empty all the way out, you might get some of that stale air out of your lungs. You kind of get some coughing sometimes. All right,